Medical misdiagnosis is more common than you may think. It's more common than drug errors or wrong site surgery, and it can be deadly. The Journal of the American Medical Association says 150,000 Americans are misdiagnosed every year, and 1 in 3 patients die or are debilitated. CBS News medical contributor Dr. Holly Phillips is here to explain why this happens so often and what you need to know to avoid it. Good morning, Dr. Holly.
Good morning, Nancy.
So what are some of the causes for all of these errors?
Right. You know, there are a number of different contributing factors, but probably the most important is that we no longer have family physicians. It used to be that your doctor knew you, your mom, your sister, and so if there was a change in your condition or symptoms, they picked it up right away. Now we change doctors, kind of like we change our shoes, so they don't know us. The other thing is that patient volumes have gone up. Doctors are seeing more patients in the same amount of time, so the visits themselves are shrinking. And there's also just a failure to follow up on these diagnostic tests. We have great diagnostic testing out there. Sometimes the diagnosis is actually on a sheet of paper in your chart, but no one has looked at it. So those are areas where we really need to make a change.
And the scary thing is, some of these mistakes are really pretty serious.
They can be absolutely life-threatening. You know, between 40 and 80,000 Americans are thought to die from either missed or delayed diagnoses. So this is something where these numbers, and looking at a study like this one, is a very good thing because it can help to change the way we practice medicine.
We all heard that electronic medical records were going to change this because your information would be able to follow you everywhere. But in a lot of cases, those records don't end up getting transferred from doctor to doctor.
Right. There are really a lot of kinks in the system. We have to get the electronic medical records really to follow you everywhere. A hotbed of diagnostic problems happens in the emergency room, where the doctors don't know you at all. That's where you see life-threatening abdominal bleeding, misdiagnosed as heartburn, or even a stroke just misdiagnosed as dizziness. So these are really areas where hopefully we'll see a change both with medical records and with the way we think about diagnosing.
Oh, great information. Dr. Holly Phillips, thank you. Happy Mother's Day.
Happy Mother's Day.
Good to
You
have
too.
you.